Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call. Jirair Ratevosian is an associate research scientist at Yale, an infectious disease fellow at Duke, and a graduate of the Johns Hopkins Bloomberg School of Public Health. He recently resigned from a top job in global health at the State Department to run for Congress in California's 30th district. Spoiler alert, he didn't win. But he did learn a lot, and he joins Dr. Josh Sharfstein today to tell his story. Let's listen.
Dr. Jirair Ratevosian, thank you so much for joining me today in Public Health on Call to talk about your run for Congress.
Hi, Josh. Thanks so much for having me.
So let's start with your background in public health. Tell me a little bit about yourself.
Sure. Let's see. I've always been interested in, I'd say, medicine. It was late in undergrad that I discovered public health. I kind of fell into it accidentally, really. This was about 20 years ago. And, a lot of schools at the time didn't have public health as a subject matter. And I went to UCLA, and while there was a school of public health, I didn't really know about public health. And when I discovered that public health offered the intersection of medicine and social issues and politics, all the things I was interested in, I kind of fell in love with it. So from there, I got a master's degree at Boston University, then came to Johns Hopkins to get a doctoral degree in public health. Lots of ups and downs along the way, but been working in public health across various sectors, in government, in the private sector, nonprofit, community organizations. It's been a fun couple decades.
Tell me about one of the more recent jobs you've had in public health.
The most recent job was at the State Department. I was chief of staff to the U.S. ambassador for global health diplomacy and global HIV/AIDS, known as the PEPFAR program. And I had really the opportunity to flex all the things I had learned about in terms of health policy, memo writing, how the Hill works and how the Hill works with U.S. government agencies, how you move a big bureaucracy to implement a policy, even though you have a policy alignment at the highest level. Sometimes even that's not enough, And so it's a really great experience at a time when PEPFAR was experiencing some radical challenges from Congress in terms of its, reauthorization, going through big changes related to its future and sustainability, working with governments to get greater buy-in in HIV programming. It was really, really a great experience.
So you are having a big impact at the global level. You're working for the federal government, but you are thinking about running for office. Tell us what that thought process is like.
Yeah, well, what happened was I was working, as you said, I was working in the federal government, and kind of by chance, my hometown member of Congress, Congressman Adam Schiff, who'd been my member of Congress for more than half my life, decided to run for Senate and to vacate his post, so to speak. And so there was an opening for the first time in the district in Los Angeles where I was born and raised. And, I got some calls and interest from folks who said, "Are you thinking about running? You should run." And for me, it kind of created this opportunity to channel something I was very concerned about, Josh, which was during the height of the COVID pandemic, we really saw the erosion of trust in our healthcare system because COVID and the way the Trump administration handled the COVID response over-politicized the issue, over-politicized the public health institutions. And I was looking for ways of channeling my anger and concern. And I decided to run for the seat because I see that the erosion of trust in public health is really a public health crisis. And we're going to have to address that if we want to really fix the inequities that continue to persist. So
let me ask you this. Was it an easy decision to run, or did you have some reservations?
Oh, gosh, no, a very difficult decision. It sounds easy to say out loud, but at the time, there are a number of factors, personal, professional at the State Department. I was doing my dream job, being a chief of staff at a big bureau. I had just gotten engaged, so there were some personal sacrifices that we had to make to move back to the other side of the country, to go back to my hometown to run. There are financial risks involved. No one pays you to run for Congress. So I had to quit my job, of course, and then run for Congress. Very, very difficult set of conversations with family, with friends, with advisors. Nothing was easy except for actually launching the campaign itself.
All right. So let's just say on Monday, you reach this difficult decision to run for Congress. What do you do on Tuesday?
Well, for me, it was funny because I had to quit my job even before I made some official campaign-related, activities in terms of getting advisors together. You decide to run for Congress, and then you need a team of advisors. That's number one. You call your friends who you trust. You ask them to volunteer a few hours to help, set up a platform, set up what you believe in, why you want to run. You have to answer those fundamental questions in your gut about what is it that is causing you to do this, and you have to develop real good answers to those questions. Why do you want to run? Why do you care? Why do you want to put yourself and your family through this? If you have good answers to those, then you're on the right track. So I got 4 or 5 people together in the living room of my home, and we began kind of sketching out what issues I wanted to focus on, what I believed in, how my personal experiences as a son of immigrant, as a queer American, as an Armenian American, how did all of those shape my value system, my beliefs, and ultimately why I wanted to run. Those are the things you do in the first few days. Well, you also get another friend to help you set up a website.
Okay, so you need a website to put those ideas up. What else do you need to run for Congress?
You need tons of folks to commit to giving you a lot of money. For better or for worse, that is the way our system is set up. And I knew that I was going to be disadvantaged because the race that I was entering already had 8 or 9 people at that time declared. And 5 of those 9 people were other elected officials who were in the race, and they had already raised $500,000 to $600,000 themselves at that point. And so I was already at a financial disadvantage. I knew that I would have to do some catch up. I spent that first month after we decided that we were running on the phone, maybe 10 hours a day, Josh, calling every single person in my Rolodex. I may have even called you. And you call everyone you know, and you share why you're running, and you share that this is an enormous undertaking that needs a lot of financial resources, and you ask people for money. That's what I ended up doing 90% of the time the first month I ran, and then a great percentage of the time afterwards as well. For better or for worse, that's just how it is. If you don't have the dollars, you can't communicate, you can't show up to events, you can't create campaign materials to communicate to voters, you can't get your ideas out. And that's expensive to do, especially in markets in California, like in Los Angeles.
So I want to ask you what it's like to run for office with a background in public health. For maybe the halls of the School of Public Health, you say, I'm really interested in rebuilding trust in public health, and everybody's excited. I don't know that that's true when you walk in a neighborhood and you just talk to people. What was it like?
Oh, yeah. No, that you're definitely right. I had some growing pains, to be honest with you. I worked in DC for 10 years. For me, I was a policy wonk in terms of the way I was thinking about public health issues. And I learned early on that didn't really connect well with voters. The average voter thinks about health issues as regular kitchen table issues. My price of my prescription drugs are too high. I just got a bill from my doctor's office that I can't afford. My insurance premium is too high. Or, why do we have all these vaccine mandates? And so I had to kind of get out of that policy orientation that was in my head and really break it down in terms of what people were saying, hearing about what they were concerned about, and then offering to translate that into policy solutions. That was an early learning that I had to do in terms of the shifting the way I speak and shifting the way I talk about solutions. But I also realized, Josh, we have a problem in public health because in terms of public health communication, at school and even my doctoral dissertation, we talked a lot about equity and framing healthcare issues, in an equity lens. And my campaign was unapologetically framed as an equity platform, and not just for healthcare issues, but for housing and even foreign policy. But most people don't know what that means. And so you really have to explain the consequences of having an equitable approach to a policy solution.
So let me ask you this. I'm in my house, minding my own business. The doorbell rings. You're there. What do you say?
I did that 30,000 times, by the way. What do I say? I say, hi, my name is Jirair Ratevosian. I'm one of your neighbors from XYZ city. I just wanted to introduce myself, and I wanted you to know that I'm running to represent you in Congress. I felt that it was important to make a neighborly connection first, because people don't like to talk to anyone who they don't know, of course. But then also talk about representation, why that representation is so important.
And then what if I said, so why are you running?
Yeah, so I ran. What I would say is that public health would come up early, and I would talk about why I wanted to run to restore trust in public health, to fight for people's rights, to fight for access to abortion rights, fight for sound foreign policy that promoted international cooperation. I'd get into the issues early on. Most people only give you 30 seconds, so you can't say too much. But really, it was about being an advocate for them. I wanted them to know that I wanted to be an advocate for them every single day.
You can tell me whether this is true, but I imagine you cross paths with some people who are disillusioned with politics, who might say something like, why would you even want to go to Congress? Or I don't trust any of those politicians. How would you handle that if that was true?
No, and I actually heard a lot about that, Josh. People would often think I was, in their words, crazy to quit my State Department job to run for Congress and want to be a freshman member of Congress, because it's difficult. You're focused on fundraising constantly, and the institution is not working the way it's designed to work. Really, people don't have an incentive to be bipartisan and to work to get things done. But that was the exact reason why I wanted to run, is because we needed younger representatives. We needed more representation from queer people, from immigrant families. And I told people that I wanted to run to actually get things done. I wanted to problem solve. And if we don't have more people who go into Congress with that kind of attitude, then we're not going to get that institution to work better for average day Americans, for families, or even for foreign policy issues. And wanting to make Congress work better was a big part of my framing as well.
What was your favorite moment from the campaign?
I like the door knocking. Me myself knocked on almost 30,000 doors, and over the course of 7 months, I really enjoyed getting to talk to people in a real substantive way. Most of the time, people, like I said earlier, give you 30 seconds. You're quick. You drop a piece of literature, and then you're out of there. But once in a while, people come out of the door. People say, "Hold on a second. Let me just put this down. I'll be right out." And then they come out. I knew it was going to be a good conversation, sometimes challenging, but when people really share what's on their mind, what they're concerned about, why they care about their kids' future, why they're concerned about, foreign wars, having those kinds of meaningful conversations really remind you what's at stake in terms of having a representative who cares and who can really represent you in Congress and go to Washington to actually solve the problems that people ultimately care about. Those conversations were really meaningful. And I have to say, most people, you'll find this funny. They talk about social determinants, even though they don't obviously use that framework. But when voters talk about issues, they talk about them in an intersectional way. It's not just healthcare issues. They talk about healthcare and education and housing. So as a trained public health professional, understanding the intersectionality of those issues helped me not only be a bit better listener, but then ultimately be a better advocate for them in the way I was framing solutions, because I understood how those complex issues are interconnected.
So you were a long shot candidate and you were not able to win the race, but it sounds like you learned a lot.
I learned a lot about myself. I learned a lot about the intricacies of campaigning, the good, bad, and ugly. And I do it again, Josh. I definitely would. I think that more public health professionals are needed in Congress. We have only less than 25 members of Congress. We looked this up, that have an advanced degree in anything, a PhD in science or engineering. And think about the billions of dollars that Congress controls in terms of Medicare spending, the Affordable Care Act and all of its components. And we need more public health leaders in Congress. And that issue is more important than ever. I definitely like to run again in the future.
It sounds like I should say that you were bitten by the political bug in this process.
Well, my mom would say I was bitten by my political bug, when I was 10 years old. But I think we all are finding ways to channel our passions, our anger, our concerns about, our future. My husband and I are in the process of having kids. I want my kids to grow up in a society that values their rights, their full potential, and the older you get, the wiser you get, as they say. But I think more public health professionals, more diversity is needed in Congress, and we need a better attitude in Congress. People need to go there to solve problems. Unfortunately, what we've seen in the last 14 to 16 years is people are going to Congress to stop things from happening. And that's caused a lot of division and chaos in DC, but we can't give up on it. We have to make Congress work.
Well, I wish I could bottle your attitude and send it to all of our representatives. Before we go, could you talk me through this campaign poster you have behind you?
Oh, yeah, you spotted it, huh? Yeah, well, Josh, it's one of the things we were able to spend some money on. If you raise enough money, you can spend money on doing surveys to understand, how people think about different issues. And so we spent quite a big amount on doing a survey to understand what 3 words to use as part of my official ballot designation. And that's important, right? Because I had 17 other candidates I was running against. And so I had the space of 3 exact words to use. And you use those words to describe either your profession or what you stand for. And we tested a number of different combinations. And what came up on top was 3 words that I'm proud to associate myself with, and that's public health advocate. We tested former State Department official, global health diplomat, but public health advocate came on top, and I'm proud of those 3 words.
And so your poster reads?
My poster just reads public health advocate Jirair Ratevosian for Congress. It was I was surprised, but pleasantly surprised that because from the beginning, I wanted to focus on public health, and the polling that we did show that resonated with voters.
Dr. Ratevosian, thank you so much for walking us through this, and we look forward to watching your career in the future.
Thanks for having me, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.